That was my 30th birthday present, was to find out that I was HIV positive. So I've been living 18 years with this virus. Actually, no, it's been living with me. It's been living with me under my terms and my conditions, because that's just the way it has to be.
AIDS are sexually transmitted diseases.
HIV is probably like two person, and let's say like
it's a disease that you get from HIV.
HIV is a virus that can infect humans and cause disease like we just talked about. AIDS is the condition that someone will develop, or that the vast majority of people will develop after they've had HIV for a long time.
You contract it through sexual intercourse.
you can probably get it from like food and all those kind of stuff.
Having sex, I guess, needles, and I feel like it's the only way you can get it.
Blood, semen, and vaginal secretions, those are the three primary routes of transmission because we're talking about sex and shared needles. You don't get it through kissing because it's not in saliva. It's not in pee or poop. Okay, so fluids that are usually meant to go out of the body, with the exception of semen, don't have HIV in it.
I have no idea.
I don't know yet. I don't know that.
Ages 16 to 20 because they're the most sexually active.
Pretty much everybody that has tested positive here at AIDS Project Worcester has been under the age of 35. Vast majority of them have been in their early 20s. And the current epidemic nationally is predominantly found amongst young gay and bisexual men of color, so African American men and Latino men.
I think there's a range of reasons why brown and black folks are disproportionately impacted by HIV and other health diseases, and it's not clinical or medical. It's really based on where we live, our environment, and how we are treated once we enter into the healthcare system.
I happened to know somebody who unfortunately had contracted HIV a few years prior. As I was learning more and more from him about HIV and AIDS, I noticed I was falling in love with him. I remember after we were having our relations, as we would call it, he said to me, "I think that you started your period," and I'm like, I just had it, so I know it wasn't me. He then told me that the condom broke. So I'm like freaking out because I don't know what to do now because the condom broke. If you add the temperature of blood, friction from having sex, you have a broken condom and you have somebody who's waiting 3 to 6 months to find out if she's infected. When you become infected, you have a marriage with your medication. When I first was diagnosed, it was a lot different. I was taking 14 pills a day, and 3 different times a day I was taking them, and that was a lot.
HIV is the most heavily researched disease ever in the history of mankind, and it is it's really remarkable how much progress has been made in treating and controlling it, such to the point that the vast majority of patients who are on treatment and take their medications are expected to be fully well controlled and have a normal life expectancy.
My medication for the HIV/AIDS is $1,600 a month, which is a lot of money. And there are some people that don't have that kind of money.
The idea that there are waiting lists for HIV meds is, in some states, is still kind of overlooked, whereas a state like Massachusetts that taxes its citizens a little more than other states, but also provides much better public health benefits. Mass Health covers all HIV medications for everybody, which is really wonderful. Unfortunately, there are a lot of people still, for reasons related to poverty, mental illness, or substance abuse, who, for whatever combination of those reasons, are unable to take their medicines every day, who will still succumb to AIDS and death.
If you live in a place where there are limited facilities, healthcare facilities, right? So if you have to take 2 buses and a train to get to your hospital, right? Or to get your primary care physician, you have a less chance of actually accessing health services.
Condoms.
Yeah, not sharing the same stuff like blade and knives.
Not sharing needles and not having sex.
Nobody's immune to HIV. People need to protect themselves to the best that they can if they're sexually active or they're injecting drugs.
We tend to not talk to our youth, right? And so, your mom, you might be wondering about something around sex, and your mom will say, we're not talking about that, we're not talking about that, or just don't do it. So youth are engaging in sex and sexual practices at young ages. I think that's one realization that adults and parents need to have. Schools are where our youth get a lot of information about a lot of things in life, right? Because that's where you're hanging with your peers. One critical strategy needs to be that sex ed needs to be back in schools in a very deliberate way.
Um, 0% likely, because I believe in abstinence and not doing drugs. Not at all, because not having sex anytime soon, so no. I'm not sharing needles with anybody, so 0 chance.
This whole agency is full of people that thought that HIV could not happen to them.
When you're young, you're not thinking of mortality as much, that this could actually happen. And I think that we've reached a level of comfortability where we're not having more discussions. So I think that being able to pay attention to the data, seeing what's happening, seeing what trends are happening, and if we're seeing right now that this is affecting such a population of young people, then we need to start having more conversations. I think that families need to start having more conversations. Faith-based communities need to start having more conversations. Organizations, I think, even in the schools, I think anything that's putting our youth at risk of anything is something that we should be having conversations about.
Well, I wouldn't stop being their friend or anything, but I'd be like, yo, you need to go to the hospital and get some medicine.
If you can think about how difficult, number one, it is to find out such a life-changing thing about yourself, that you have HIV, and then to feel like you can't tell anybody about it, it's incredibly stressful and hard for them.
The LGBTQ community definitely gets stigmatized. Stigma creates so many barriers in terms of people not wanting to access care, people not wanting to know their HIV status. And once, even if they know their HIV status, not wanting to get treatment or medication. You can get this virus, it's still around, and it's alive and kicking. But you know, when you get it, know that there's help for you.
My name is Michelle Smith, and I'm proud to be the Executive Director of one of the oldest AIDS service organizations in the country, AIDS Project Worcester. APW has provided individuals in Central Massachusetts with critical wraparound services for those infected with HIV, which include housing, hunger prevention, mental health counseling, transportation, referrals to medical care, as well as crucial prevention services, which include HIV education, testing, and outreach services. When the agency began in 1987, we assisted people with dying with dignity. Today, in 2014, we assist people with living with dignity. It's with the continued support of the community as well as our community leaders that we're able to provide the services that we continue to provide to this day. Without you and your support, we would not be able to offer the many things that people who are living with and are affected by need on a daily basis. For that, on behalf of the staff, the population that we serve, the board of directors, I thank you and I appreciate your care and support.